Welcome to the Canberra Region Cancer Centre, a division of the Australian Capital Territory Health Directorate. This centre provides a fully integrated service for patients who require radiation oncology, medical oncology, immunology, haematology, palliative care, as well as cancer care nurse coordinators and psychosocial cancer care services. This DVD has been produced to provide you with information on radiation oncology and radiation therapy at the Canberra Region Cancer Centre.
Hi, my name is Hani Al-Sala. I'm the Director of Radiation Oncology at the Canberra Region Cancer Centre. The aim of this DVD is to provide you with information about our department, the combined care team, and what to expect during your radiation therapy treatment journey. Radiation therapy is a common form of cancer treatment. For some patients, it can be the sole form of treatment, while for others, it may be used in conjunction with surgery and chemotherapy. There are two types of radiation therapy: external beam radiation and internal radiation, also known as brachytherapy. In Canberra, both forms of radiation therapy are used depending on your diagnosis. Each course of radiation therapy is tailor-made. For some patients, it may be delivered in a single treatment, while for others, it may need to be a course of up to 7 weeks. The number of treatments is based on clinical evidence and will be advised by your radiation oncologist. Our radiation oncology department provides state-of-the-art care to patients delivered by professionals in a caring environment. If you or your carers have any questions or concerns after watching this DVD, please speak to any of our staff.
There are two main parking areas at the Canberra Hospital, including the multi-storey car park that has direct access to the Canberra Region Cancer Centre. When you enter the centre, there are signs directing you to the reception counter. Staff at reception are available to assist and refer you to an appropriate person or location as required. On your first visit to the department, please report to the reception desk and advise the staff of your arrival. Reception staff will ask to see your Medicare or DVA card and will ask some other personal information to verify that your details on our computer system are correct. This information will be checked by reception staff at every consultation you have with the radiation oncologist. The reception staff will also require you to fill out a patient questionnaire before the consultation. This information is provided to your radiation oncologist. After your consultation, please return to the reception to check out. Before your first radiation oncologist consultation, a clinic nurse will see you and do some general observations of your overall health, including blood pressure and weight, and ask a few questions. Your radiation oncologist will then see you. A radiation oncologist is a specialised medical professional who has trained for many years to develop expertise in the use of radiation to treat cancer. At the consultation appointment, they will assess your disease, discuss radiation therapy treatment options, and identify side effects that may occur as a result of the radiation treatment. They will also answer any questions you may have specific to your diagnosis. If you consent to proceed with radiation therapy during the discussion with your radiation oncologist, you will require another specialised appointment known as a CT planning appointment. Our patient liaison officer will contact you to advise you of the time and date of the CT planning appointment and refer you to a social worker or cancer nurse care coordinator if necessary. The date of this appointment will be dependent on your diagnosis. When you arrive for your CT planning appointment, come to the reception counter and the receptionist will advise the radiation therapist that you have arrived. The reception staff will also ask you to check and sign a Medicare or DVA billing form that allows us to claim a rebate for the cost of your treatment from these agencies. A radiation therapist will meet you at the reception counter and explain what will happen during your CT planning appointment. Radiation therapists use advanced computer systems to operate sophisticated radiation therapy equipment. They work closely with the radiation oncologists and other allied health professionals. They effectively design and treat the course of your radiation treatment. The aim of your CT planning appointment is for the radiation therapist to set you up in the position that you will be in for your radiation therapy treatment appointments, using specialised equipment, and to perform a CT scan. Most areas of the body having radiation therapy need to have small pinprick-sized tattoos around the area. These are used to line you up in the same position for your treatment. If you are having treatment to your head and neck area, then a mask may be made at this CT planning appointment. The mask ensures that your head is kept as still as possible during your treatment. You can still see through the mask and breathe normally. The CT planning appointment may be up to an hour in length, with the CT scan only taking a couple of minutes. During the scan, it is important to attempt to be as still as possible while breathing normally. The CT scan information is not used to diagnose anything, but it is used to plan your radiation therapy treatment. The radiation therapists work alongside your radiation oncologist to ensure that your treatment is planned precisely using sophisticated computer systems. The radiation therapist at the CT planning appointment will provide you with a blue appointment card, which contains personal identification details, a barcode, and details of the first treatment appointment. Your first treatment appointment date and time will be based on your diagnosis and treatment requirements. This may be up to a few weeks after your planning CT. Just after your CT planning appointment, one of our radiation oncology nurses will talk to you in regards to skin care and management of any side effects you may have during your treatment. They will also answer any queries you may have about treatment, accommodation, transport, and refer you to a social worker or cancer care nurse coordinator if required. After this appointment, the nurse will take you back to the reception area. At the reception area, you will be shown how to use the self-check-in system when you return for your daily treatment appointments. This system uses the barcode on your blue appointment card. When you come for your treatment appointment, scan your card at reception, and this will notify the treatment radiation therapist that you have arrived. Staff are always available at the reception if you need assistance. After scanning your appointment card, hand this to the reception staff and then collect it at the end of your daily treatment. On the first day of your radiation therapy treatment, the administration staff will ask that you take a seat in the main waiting area. The radiation therapist who meets you will give you a list of appointments for your course of treatment. Please try and arrive on time for these appointments, as it is difficult to reschedule your appointment if you are late, and it may impact on other patients. Please discuss any appointment concerns with your radiation therapist team. You will be taken to a sub-waiting area where you will be provided with a gown and shown where to change. The radiation therapist will also give you an opportunity to ask any questions, and they will provide you with further information about what to expect during treatment. Due to limited space and privacy of others, carers are asked not to accompany patients, but instead to remain in the main waiting area. External beam radiation therapy uses a linear accelerator or LINAC to deliver the radiation. The Radiation Oncology Department at Canberra Hospital has 4 of these machines. To ensure that these technically complex treatments can be carried out safely involves a lot of regular servicing of the LINACs, carried out by our physicists and engineers based within the department. This may mean that you do not have treatment on a servicing day, or that you have treatment on another LINAC capable of delivering the same radiation treatment. A radiation therapist will bring you through from the waiting room to the LINAC. There will be an area within the LINAC room to leave your belongings and an automatic hand sanitising system available for use. Before lying on our treatment couch, we will check your full name, date of birth and address, as well as confirming with you the part of your body being treated. We also need to uncover the area being treated so that we can see any tattoos made at your CT planning appointment. Once you are lying down, we will spend some time lining you up using our positioning lights. Throughout this process, we will need you to be as still as possible and breathe normally. Once you are in the correct position, the radiation therapist will leave the room. They will be in a console room next to the treatment room where they can see you and hear you using cameras and an intercom at all times. During treatment, the radiation therapist may take some images to confirm your position is correct. It is important that you do not get off the treatment couch unless instructed by the radiation therapist, as it is raised during your treatment. Once you have been positioned, the treatment usually takes less than 20 minutes every day. During treatment, the linear accelerator moves around you to specific angles that were decided during planning of your treatment. It will not touch you throughout the treatment, and you won't feel anything or see anything when the radiation is switched on. There will just be a low buzzing noise. The radiation therapist can stop the machine at any time and come into the room if necessary. Undergoing radiation therapy will not make you radioactive. After your treatment, you are free to interact with friends and family as you would normally. The radiation therapist will then direct you to a nurse who will share in the ongoing management of your needs during your course of treatment. They will discuss side effects and skincare with you again.
These are some of the important things to be aware of during your radiation therapy. Avoid direct sunlight and heat on the treatment area. Drink plenty of water to avoid dehydration and eat a balanced diet. You may be referred to a dietitian to help you manage this. Rest more because treatment can make you a little bit more tired than usual. Wear comfortable, loose clothing around the treatment area and only use creams, soaps or deodorants that is recommended by nursing staff. And if you're being treated around the neck or the head, use only an electric shaver.
The nurses will see you once a week after your first day. They will also advise you of your radiation oncologist or registrar review day once a week. This will be from your second week of treatment. If you have queries or start to experience any side effects during your treatment, let a staff member know this. Even if it is not the day that you usually see a nurse or your radiation oncologist, we can organise an appointment for you with a health professional. With all side effects, everybody is different. Some patients have no side effects at all. But as a combined care team, we are equipped to manage any side effects that you may have. Radiation therapy is part of the comprehensive cancer services available at the Canberra Region Cancer Centre. There are other important support teams that you can be referred to throughout your treatment journey. These include, but are not limited to, cancer nurse care coordinators, dietitians, social workers, clinical psychology and physiotherapy. Your treatment team will link you with appropriate support services within the Canberra Hospital or to people to answer any questions you may have about your treatment. After you have finished your treatment, the nurses will see you on your last day, where they will provide you with details about how to contact the department with any queries or concerns regarding side effects. There are also weekly nurse-led clinics available for you to attend until your follow-up appointment with your radiation oncologist. Your follow-up appointment is usually about 6 weeks after your final treatment.
Throughout the year, there are many support groups available, including those with links to the Cancer Council within Canberra and surrounding areas. In the Canberra Region Cancer Centre, there is a patient information room with brochures and posters highlighting information about the many supporting events.
We hope this information has helped you with what to expect during your time at the Canberra Region Cancer Centre. We are committed to providing you with the best possible care, and as a team, we will work together to assist you during your treatment. Please feel free to approach the staff with any questions, because our aim is to make your time with us as comfortable as possible.